Welcome to the David Pakman Show. I am, of course, not David Pakman. I am Benjamin Dixon, host of the Benjamin Dixon Show and also host of Like It or Not on Content News, which are the studios that you see around me. David is traveling to a conference and he will be broadcasting remotely for the rest of the week, along with Pat and the full team there. A couple stories that I want to go over here with you while I fill in for David. So over the weekend, Steve Bannon uh, was at the Values Voters Conference, the so-called Value Voters Summit. I say that so-called because they really are a extremely fundamentalist right-wing organization, and so it's very difficult to consider them to be values voters, but I digress. Steve Bannon was there, and he made a statement with regard to the CSR payments. CSR payment stands for Cost Savings Reductions, which is a part of the Affordable Care Act. Donald Trump's executive order last week essentially has done away with the CSR payments. And the purpose of doing this, according to Steve Bannon, was to blow up the exchanges. We have the video of that clip, and I want to take a listen to it right now.
Then you had Obamacare, not going to make the CSR payments, going to blow that thing up, going to blow those exchanges up, right?
Now, the irony of this is that you have the audience celebrating and everyone cheering and applauding. But according to the Associated Press, 70% of the people who are going to be hurt by this are actually voters from states that Donald Trump won. So it's another example of the book, What's the Matter with Kansas? And you have Republicans audibly celebrating and cheering on something that is going to hurt them. Not only Republicans, obviously, when they say 70%, it's going to hurt everyone in those states that need these cost-saving reductions. And so what the cost-saving reductions essentially are were payments that the federal government, particularly the executive branch, were making to insurance companies as a part of the Affordable Care Act. And these reductions were designed to reduce the amount of money poor people or people who lived that made about 200% to 250% of the poverty line. It gave them the ability to reduce their not only their premiums, but specifically their copays and their deductibles. So over a year period, the Silver Plan, if any of you are have Obamacare, you should be familiar with their terminology. The Silver Plan was for people who made about 400%, or I'm sorry, 200% of the poverty line. And the Silver Plan, with these cost-saving reductions, lowered your annual deductible from around $3,600 down to about $200 a year. And so now, without these cost-saving reductions, Steve Bannon is right. This is essentially going to blow up the exchanges for a couple of reasons. One, it's going to force insurers to increase premiums. And it's going to destabilize the confidence. These insurers don't really know how much they need to charge because they don't know what's going to happen year after year. And so in two very specific ways, it's going to help destabilize the markets. And the problem is that this is something that they're doing without a replacement. So instead of having something to replace, repeal and replace, as Susan Collins from Maine mentioned, one side of the debate was about repeal and replace. And they were not able to do that because they are completely broken apart. They're scattered. They don't really know how to bring a consensus together on how to move forward on healthcare. And there's a very specific ideological reason why that is. But Susan Collins pointed out that this step that Donald Trump made is not about repealing and replacing. It's simply about hurting Americans. We have a clip of her over the weekend from the State of the Union with Jake Tapper. Let's take a listen to that clip.
The debate in Washington has been on whether or not to repeal and replace Obamacare in the future. What the president is doing is affecting the ability of vulnerable people to receive health care right now. This is not a bailout of the insurers. What this money is used for is to help low-income people afford their deductibles and their copays so that their health care is available to them. In addition, the president has taken steps to cut off funding to reach people who are eligible for subsidies under the ACA. So these certainly are very disruptive moves that will result in smaller numbers of people being insured, that will make it more difficult for low-income people to afford their out-of-pocket costs, and that will destabilize the insurance market.
And so this is the overall goal of Donald Trump. His goal all along has been to destroy Obamacare by any means necessary, even if it means hurting people, 70% of whom are in states that voted for Donald Trump, even if it means not having a replacement, anything and everything he can do to destroy Obamacare, not because he has something better, but because he has a vendetta against President Obama. Now, Donald Trump actually spoke about that earlier today, and listen to his tone, listen to what he's saying. More specifically, listen to the driving force behind him. He is so obsessed with doing away with Obamacare that he doesn't care who he hurts in the process. Let's take a listen to that clip.
With the CSRs, because I cut off the gravy train. If I didn't cut the CSRs, they wouldn't be meeting. They'd be having lunch and enjoying themselves, all right? They're right now having emergency meetings to get a short-term fix of health care, where premiums don't have to double and triple every year like they've been doing under Obamacare, because Obamacare is finished, it's dead, it's gone. It's no longer, you shouldn't even mention, it's gone. There is no such thing as Obamacare anymore. It is and I said this years ago, it's a concept that couldn't have worked. In its best days, it couldn't have worked. But we're working on some kind of a short-term fix prior to the Republicans getting together, maybe with some Democrats.
So here he is. He's frustrated because he can't get Obamacare repealed. And so now he's doing everything he possibly can by dismantling the program, particularly with these cost-saving reductions. And the entire intent was to blow up the exchanges. This shows you a level of contempt for or lack of concern for the American people. And I think in many ways it seems pointless to point this out, but it's necessary for us to point this out. This move is so detrimental to the American people, it's almost hysterical, because it's not only targeting the poor people who needed these cost-saving reductions, but it's also going to hurt the people who did not get cost-saving reductions. It's also going to inflate premiums for the average American. The premiums are considered are possibly going to go up about 20% because of this move. So it's not only people who needed Obamacare who are going to be affected. Every single American is going to be affected if they have insurance of any type. And Donald Trump doesn't care. Donald Trump doesn't have a solution. Donald Trump doesn't have a better way forward. Donald Trump simply has a vendetta against President Obama. Now, this vendetta actually falls in lockstep with the overall Republican ideology. Now, this is the second half of the conversation, right? One of the reasons Donald Trump is so frustrated is because Republicans can't move forward, and Republicans can't find a way to repeal and replace Obamacare despite 8 years of making promises. That's because they ideologically do not have a path forward that is any more conservative than what Obamacare already is. If they had a solution, they would be able to put it on the table. They do not have a solution, and that's because Obamacare outflanked any of their ideas from the right. Obamacare is a conservative piece of legislation. It takes market solutions and applies it to the healthcare system, creating these exchanges. And this is precisely what Republicans did in Massachusetts with Mitt Romney. This is exactly what the Heritage Foundation promoted previously. And because Obama did it, they are more obsessed with undoing Obama's legacy than they are with at least admitting that the plan that we currently have, as flawed as it is actually a plan that they would have implemented had Obama not done it first. And because they don't have any ideological way of going any further to the right without absolutely destroying Americans, they can't find a solution whatsoever. And this is a particularly hysterical quagmire that they have themselves in, because they want to do something, but they have nowhere else to go except for kill as many Americans as they possibly can, because they will put, and this is not hyperbole, right? Let me take a step back. People get upset when we talk in inflammatory sentences like this, but there's a study that revealed that there's 10 to 40,000 people a year that would die as a result of lack of coverage because of any type of repeal of Obamacare. Even with this one move of Donald Trump doing away with the CSR payments, Donald Trump is getting ready to knock off 1 million Americans. This single move is going to cause 1 million Americans to no longer have access to affordable health care. And this is what the Republicans are faced with because they don't have any way to outflank it. So ideally, you would think, well, what's a better solution? And the Republicans would say, okay, let's get a better solution. But that's wishful thinking because the better solution is really Medicare for all. Medicare for all is the way forward because we have a system, and this is particularly important. Donald Trump right now is able to undermine the Affordable Care Act with the stroke of a pen because he has that capacity as the president of the United States, even without Congress. Congress could undermine the Affordable Care Act every single year if they had authorized these CSR payments, but they didn't. So President Obama back in 2014 took it into his own hands and used the executive branch to authorize these payments from the Treasury. Well, this presupposes that you are going to always have somebody in power that is actually a decent human being, right? Obamacare required that you either have a House of Representatives and a Senate and a president, for that matter, to sign off on the budget, but to at least have a House of Representatives that were willing to sign off on the CSR payments annually as a part of their budget. And we haven't had that since the Republicans took over in 2010. I believe 2010 was the year that the Republicans got the majority in the House. So Obamacare required and necessitated to have decent people who cared about health care for all in the House of Representatives, or at a minimum in the White House. And without having somebody decent in the White House, we now see that Obamacare is uniquely vulnerable because we have a president who has the ability to sign away a system that is going to fundamentally destabilize Obamacare. All right. So there's a lot more to cover on this issue, and we'll definitely keep our eyes on it. But I think it's very important for us to see these fundamental flaws in Obamacare, not as a way of criticizing what President Obama did or what Nancy Pelosi did or what all the other people who did. They put a lot of time into building it, but now we see it's very exposed how detrimental, or how vulnerable rather, this program is to the whims of a narcissistic president. And because of that, I think it's vitally important that we begin to advocate for the same thing that Kamala Harris is advocating for, the same thing that Elizabeth Warren is now advocating for, the same thing even Cory Booker is advocating for. And of course, Senator Bernie Sanders, they are all advocating for Medicare for all, because we cannot afford to have a system that is dependent on the benevolence of the people in power. We need a system that is steady and stable and doesn't change with the changing administration. We'll be back right after this.